Hi there, welcome back to Histo with Ale. Today we're going to talk about different factors that affect fixation in the tissue. These factors influence the effectiveness and quality of tissue fixation, and most of them can easily manage or adjusted in the lab. Since it is a lot of information, this will be divided in two separate videos, so stay tuned for the second part. According to Frida Carson textbook, there are 9 main factors that impact the fixation process. The first factor is temperature. The temperature plays a key role in how fast and effectively tissue fixation occurs. A higher temperature increases the rate of chemical reactions, which means the fixative penetrates and stabilizes the tissue faster. However, raising the temperature too much can cause tissue distortion, protein over-denaturation, and loss of fine structural details. That is why room temperature is typically preferred for routine fixation, especially with formalin. In some labs, we can find microwave fixation. These are used to raise the temperature in a controlled way. This speeds up fixation without overheating the tissue, preserving both speed and quality. Especially helpful in urgent cases and sometimes in laboratories that process biopsies only. Sometimes, the temperature during fixation is lower to slow down the process. This helps reduce enzymatic activity without causing proteins to denature too quickly. A common example of this approach is when preparing specimens for electron microscopy, where preserving fine cellular detail is crucial. Another example is when preparing a frozen section for a rapid diagnosis, while the patient is still in the operating room. The second factor are size and thickness of the tissue. The thickness of the tissue is a critical factor because it directly affects how well fixatives and other reagents can penetrate. When placing large tissue samples, like sections of the colon or small intestine, into fixative, it is important to open them up surgically to expose all layers. If the tissue remains closed, the fixative may not reach the deeper layers, especially the inner epithelial surface, leading to autolysis of these areas. For routine processing, tissue section should be no more than 3 mm thick to ensure proper penetration. When using faster processing protocols, even thinner sections are necessary. Tissue should never be so thick that it touches both the top and bottom of the cassette, as this can prevent uniform fixation and processing. The third factor is volume. The ratio between tissue volume and fixative volume is a key aspect of proper fixation, though sometimes it can be difficult to fully control. Ideally, the fixative should be used in a volume that is 15 to 20 times greater than the volume of the tissue. Many fixatives work through chemical bindings to tissue components. So as fixation occurs, the fixative becomes gradually depleted. In addition, the tissue releases soluble substances like salts into the solution. This creates a two-way exchange between tissue and the fixative. If a large enough volume of fixative is used, this exchange does not significantly affect the fixative properties. However, if the tissue volume is too large compared to the fixative, the solution's compositions can change, leading to poor fixation quality. In fact, many staining issues can be traced back to inadequate fixative volume, which fails to preserve the tissue properly from the start. The fourth factor that affects fixation is time. In histology, timing is everything, especially when it comes to preserving tissue after it is removed from the body. The faster the tissue is placed in fixative after surgery or death, the better the microscopic details we can see later. Delays can lead to breakdown and bacterial damage, especially in tissues like the small intestine. For example, a healthy intestinal tissue shows well-defined structures like villi and goblet cells, which are a key identifiers. But if the tissue is not fixed right away, these details start to disappear. That makes it harder to identify the tissue or get accurate test results, especially in autopsy samples. The duration of fixation is just as important as speed. Fixatives like formalin need at least 6 to 8 hours, and some studies even recommended 30 to 40 hours for best results. Rushing this step can lead to poor staining, irregular structures, or artifacts that ruin the sample. Remember, for more detailed explanations and examples, be sure to refer to the Frida Carson textbook. And if you're following along, do not forget to like, comment, and subscribe so you do not miss the next episode. Thank you.